huge tax cuts to corporations and to wealthy people. That will also help to reduce the deficit over the long run. Well, I think that this is an important issue because my opponent, Ms. Little, has said repeatedly at forums and debates that she wants to eliminate the federal income tax, which is a progressive income tax, and basically taxes people more if they're wealthy and also taxes corporations, and replace it with a national sales tax. Now, the Brookings Institute estimated if you did that, you'd have a 23-cent national sales tax on everything. And what this would do would basically shift tax policy so the wealthy and the large corporations wouldn't pay their fair share, and instead all the burden would be on the little guy, which I think is totally inappropriate in terms of tax policy. It should be progressive, and people should pay based on their income.
He does not even begin to understand. You see, the 23% tax he referred to, that he said was very unfair to the middle class, you're already paying it. You're already paying it. Through that IRS, under a fair tax, you would receive, actually, a broadened tax base where you would probably end up paying less than the 23% because more people would be paying in. It's, again, simple math. You see, more taxpayers means each individual pays less tax. Right now, 50% of Americans pay tax. We need it to be 100. I just want to respond to one other reference to growing the middle class. I would like to inform the congressman we already exist. You can't grow us, and we would like to direct ourselves.
The problem now is we have this crisis. We have so many people here who are undocumented. They can't go back because they've been here a long time. They're really Americans effectively. And you still have 11 million Americans or so that are in this no man's status. That's not going to change. As you know, I'm one of the authors of the healthcare.
Yes, we do.
And I don't think that Congress routinely should be telling physicians what to do and what protocols to follow.
And for the congressman to tell us that he has not taken action because he feels government should not intrude is very duplicitous, as he authored the health care law, which is a bigger intrusion than what we are asking him to do as far as research.
As many of you know, one of the things that I and the Congress had worked on over the last few years, the last few months, I should say, are very strong sanctions against Iran, which we voted on and passed a few months ago. And they actually are working. We're beginning to see that companies that previously invested in Iran are now not there anymore, and I think it's actually having a major impact in weakening the Iranian government. But I think that we've done quite a bit in the Congress. I mean, first of all, we passed the Recovery Act, many of you know it as the Stimulus Act, which created or saved about 3 million jobs. I think we could use another stimulus type proposal.